105.1 The Buzz, Dari, Mitch, and Ted Show. Let's welcome to the show our buddy and cosmetic surgeon, Dr. Michael Workman.
Go Hawks.
And Seahawks photographer for the Portland Tribune. We haven't seen you since the Super Bowl, have we? Because you did some traveling, we did some traveling.
Yep.
What was that like?
Oh,
if you know what we're talking about, Dr. Workman is a photographer for the Tribune, for the Portland Tribune, and you were on the field for the game and for the coin toss.
Yeah, absolutely. I got one of the white vests, which allowed me to go right out center field, and I had a special wide-angle lens, and it was really cool.
You were very nervous a couple days beforehand.
I was.
He could not say coin toss.
Coin toss. I was saying toin toss.
Toin toss.
Yeah. And I saw Katy Perry. Katy Perry just sailed right over me.
Oh, yeah.
What'd you think of the show?
Oh, spectacular. Yeah, it was just spectacular.
And even though our team lost, it still had to be an amazing night for you.
Yeah, it was. I've got the antidepressants you guys both requested, or at least you did, Mitch.
Ted doesn't care.
Yeah, Ted doesn't care.
I was like, okay.
Yeah.
All right.
Yeah.
Did you have a chance to have any interaction with any of the Seahawks players after the game? Did you see any visible tears or anything like that?
Well, I've got pictures of Russell Wilson, and just coming off the field, and you just see his handler or whoever's the agent just kind of patting him on the back, and it was really touching for me at the national anthem where I was 10 feet in front of Pete Carroll and Sherman and all those guys, and you see Pete Carroll comes up and just gives Russell Wilson this just heartfelt hug. You can tell there's love there at some level, and
that's how you make a team win. You got to have love amongst the players.
Oh, absolutely. There's a lot of love there.
Now we see those guys all standing next to each other, so there's not a lot of perspective. But when you're standing next to them, how big are those guys?
They're giants, aren't they?
A lot of them are big.
Yeah.
A lot of them are big. Sherman's not that big. It was kind of funny because you got Russell Wilson with his hand over his heart, and Pete Carroll's kind of looking straight ahead during the anthem, and here's Sherman. He's kind of convoluted into some weird body form. His head way out to the right, and just keeping track of everything. But it was pretty cool.
I would imagine.
Cool.
Seahawks from the inside.
Glad you experienced that. But we're not here to talk about Seahawks football. Unfortunately, we're talking about something equally exciting, though. We're going to talk about cosmetic surgery.
Okay.
If you're new to the show, Dr. Workman is a cosmetic surgeon specializing in breast augmentation, liposuction, and tummy tucks. And did you know you performed 400 surgeries last year alone?
I didn't keep track.
That's more than one
surgeries.
That's more than several a day.
It's a lot of breasts.
That's impressive.
And
tummies
two at a time.
Everything else. Now, when a patient comes in for breast augmentation, do they usually have in mind if they want a saline implant or a silicone implant, or is that your decision? How does that work?
Well, oftentimes, I would say 80% of the time people know, they've talked to so-and-so or been on the internet or whatnot, and they've got an inkling in terms of what they want to do. Sometimes they have no idea, and they kind of want our input. And we're probably putting 90% of the new cohesive gel implants in, just because they feel more natural and they look more natural. You're much less likely to have the rippling.
Yeah, but, you've brought those in for us to fondle.
To feel.
They're very nice to squish.
Yeah, yes, Mitch. Are you getting it? Are you understanding?
I'm not turning maybe less gay, but they're still fun to squish. Price-wise, is there a difference?
Well, the silicone, probably because of legal fees and whatnot, and all the litigation, are more expensive. I think gel are like $1,900 for a pair, and saline are probably half of that. But the good news is, the bigger you go, they don't cost more. Because people say, "Oh, geez, I don't know. I'm not sure I can afford the double Ds."
Right. And, so go big.
Go big or go home.
And safety-wise, are they both comparable now? Equal?
Yeah, I think most people would say that. I think you look over in Europe, 90 to 95% of women in Europe tend to go with the gel. Over here, we're probably 75 or 80% of American women are going with the gel implants rather than the saline, and they just feel and look more natural.
And do they last? Does one last longer than the other? I know that neither of them last forever, right?
No, I think that it's a man-made product. Not unlike a tire or a shoe, like I'm fond of telling people. But I think that we're telling people on some of the newer implants, probably 15 to 20 years, basically. But they have a lifetime warranty. Anytime during your life it ruptures, they'll give you a new one. We should come down maybe to get some man boobs in you, Mitch. What do you think?
I don't think that's necessary. I think I'm in good.
We're covered.
Yeah, I'm good.
We're covered
in that arena. When does a breast lift make sense, and is it often performed in addition to the breast augmentation?
Yeah, breast lift makes sense if we can't just put in an implant and make you look good. I think the problem with the lift for most people is we have to put more scars on the breast, so that typically we'll have a scar around the nipple and a vertical one. And I think in general, if we can get by with an implant without having to do more cutting, I think that's always better.
Another procedure Dr. Workman does quite a few of, a whole bunch of them, are tummy tucks. Is that strictly a procedure for female clients?
Oh, no. We probably 95% of the tummy tucks we do are, with females, and it primarily reconstructs what happens with, having babies or after massive weight loss. But occasionally, men have gained and lost a lot of weight, and they, just have skin hanging, and basically we sometimes we call it more of a paniculectomy. We just go in and remove a big ellipse of skin and take all the skin basically from the belly button down to the hairline, and you can get rid of it. So you can have 2.5 feet by 10 inches.
Sheesh.
And we throw that away, and then take the skin above it and pull it down.
And then how much scarring is it? There must be a pretty long incision, I would guess.
Well, oftentimes, for taking off a lot of skin, it's going to have a longer scar, but it tends to be low underneath the underwear, and it tends to go from one hip bone to the other, and it's a curved incision. But like I tell patients, a long scar doesn't take any longer to heal than a short scar.
Yeah. Right.
And so it's longer, but and they fade with time. I mean, I did this on my wife. She won't sue me because of hip, I hope. And I don't even notice her scar.
Right.
And like most scars, they fade with time.
Well, I remember my wife had two C-sections. She had that scar there, and I don't even notice it.
Yeah, and that's exactly where the abdominoplasty scar is. In fact, oftentimes we'll try and go a little lower than it, so we get rid of the C-section scar, and so kind of clean up that area.
Gotcha.
Our guest is cosmetic surgeon Dr. Michael Workman. Before we let you leave, we want to talk about Cool Sculpt. That's an amazing new procedure, and if folks haven't heard about it, I think it's worth talking about it again. Tell us what it is.
Well, Cool Sculpt is a technique that's been around about 2-3 years. It was invented by a Harvard dermatologist. It's patented, and basically it freezes fat. And you put a little applicator. It almost looks like an attachment from a vacuum cleaner, and it literally will suck a roll of fat up into this applicator, and then it applies the cooling to it. You keep it on for about an hour, and you give it a massage afterwards, and it damages the fat cells so that your body absorbs them over the next 2 to 3 months.
I know you did that to yourself, to one of your man boobs, you told us.
I know, yeah.
And have you done it to the other one now, so they're even?
I haven't.
Okay.
I mean, I look in the mirror every morning when I'm shaving, and I look down, and my left breast is bigger than my right one, and I'm going, I got to get back in and do that left one.
It's like Two-Face.
Yeah, Two-Face.
And I know you often don't know about the costs for things going on in your practice. That's more of your staff.
Right.
But is it an expensive procedure?
It tends to be, I think, around $600-$700 per area.
So that,
for instance, you get both your breasts done for, I don't know, 12-ish or something.
Wow.
Yeah, $1,200. Yeah.
And it lasts for a good long period of time, or forever?
Well, it lasts.
So you gain the weight back,
the fat cells are permanently destroyed, so that it lasts forever. I mean, don't go out and pork out afterwards and gain weight, but the results are permanent.
Impressive.
Yeah, it's pretty cool.
Yeah,
Interesting.
very cool.
Cool.
All right, if you have any questions about Cool Sculpt or any of the procedures that Dr. Workman can perform for you, just go to his website, drmichaelworkman.com, drmichaelworkman.com, and we'll see you in a couple weeks.
All right, rock and roll.